The Kansas Health Foundation is very visionary, they're very forward-looking, and they're very committed to the health of Kansas. And we're so fortunate to have them in the state.
Just by its name and by the projects it supports, I think it certainly lends credibility to the work that we try to do in public health.
They want to see us grow. They want to see us thrive. We've always felt like we could just call them and have an honest conversation.
We're in this fight with a foundation that believes that we can make the future better and that we can make our state a healthier place.
I think that's what's really exciting, is that they've given us that ability to make an impact in our area.
Continuing its legacy of enhancing public health, the Kansas Health Foundation now begins a new quarter century of working to improve the health of all Kansans. The Kansas Health Foundation can trace its roots back to the 1985 sale of Wesley Medical Center, a nonprofit hospital associated with the United Methodist Church. When Wesley was sold to the Hospital Corporation of America, the profits went to two organizations focused on improving health in the state: the United Methodist Health Ministry Fund and the Wesley Medical Endowment Foundation, now the Kansas Health Foundation. Facing many changes in the healthcare industry, hospital and community leaders help shape a vision of health promotion and disease prevention instead of traditional reactive medical care. Today, the foundation is a private philanthropy dedicated to improving the health of all Kansans as a funder and partner working with communities and organizations throughout the state.
The Western Kansas Community Foundation was started in 1996, and at that time, the Kansas Health Foundation was a real partner in the development of community foundations around the state. Giving resources to our world was started in 2001 as a way for the foundation to work with the Kansas Health Foundation as a partner in raising funds for different initiatives. They're matching grant opportunities and they're matching fund opportunities. That inspires a lot of people to want to be our partner, people we talk to about being donors. It just gives them more incentive to be a supporter of the foundation. One fund that we take a lot of pride in is our Children's Fund, and that money is granted out on a quarterly basis to support all kinds of programs that benefit kids in our part of the state. And so we've seen so many wonderful programs that have benefited from this money, and our grant committee is so pleased every quarter to be able to grant it out.
The Kansas Health Foundation has given us so many opportunities. One thing that early they did is they provided some personalized training for executive directors and program staff, and I'll tell you, that was something that we could have never afforded, but something that has really taken our foundation from where it started, $500,000, to over $16 million.
Recognizing the success of the first 10 years of Grow Healthy Kansas, the Kansas Health Foundation announced in 2009 a second chapter of Grow, to continue building a network of community foundations across Kansas dedicated to improving the health of their communities.
The majority of folks that were working in public health did not have public health training, and there was not any public health training available in the state of Kansas. So it was critical to develop a Master's in Public Health program, and the foundation actually took that and was very instrumental in seeing that that got started in the state and in funding it.
Begun in 1994, the program is now offered through the Departments of Preventative Medicine and Public Health at the University of Kansas Medical Center in Kansas City and the School of Medicine in Wichita.
And then in addition to the Masters in Public Health, they actually funded workforce development opportunities for workers that were already in the field.
Through the Secondhand Smoke Community Campaign, the foundation has had the opportunity to partner with 13 communities throughout Kansas to help them meet their tobacco control goals.
The Kansas Health Foundation targeted Emporia to help fund a campaign called Secondhand Smoke is Poisonous. And they developed the theme and the image, and then helped develop material that we could use to raise awareness of the dangers of secondhand smoke in our community. The picture that was used throughout the campaign was that of a lighted cigarette, and the smoke coming from the cigarette formed the image of a snake. We certainly raised awareness of people who hadn't maybe thought about the impact that secondhand smoke can have on others. They started becoming aware of a need to take further action. On April 9th of last year, our voters voted to enact a local ordinance that would prevent smoking in all bars and restaurants and workplaces. And then, of course, the state recently passed a state law that will become in effect on July 1st.
In 1995, the foundation established the Kansas Health Institute, an independent, nonprofit health policy and research organization that informs policymakers about important issues affecting the health of Kansans. Thanks to the ongoing work of the KHI, policymakers in the state are armed with timely, relevant, and objective information on a wide range of health-related issues.
Thrive came about through efforts that were started by local residents that were concerned about the direction of Allen County, and especially about our declining health conditions. Their efforts to get organized resulted in what's now a not-for-profit corporation that works throughout our county to make sure that we're being successful in this turnaround. Our Vision Iola project, which is funded primarily by the Kansas Health Foundation, is looking at what we can do to change the physical environment so that we improve people's health. Today we are standing on what we hope will be the extended Prairie Spirit Rail Trail, and this is something that's really about linking infrastructure so that people use trails. In this case, we're linking two parks, we're linking our downtown, and we're touching neighborhoods where there's really no good sidewalk infrastructure. So the presence of this trail is something that will make it possible for people to go from park to park and actually do it in a way that doesn't require a vehicle. Really, right here in Iola, we're doing some innovative things that over the long term are going to pay dividends for people's health.
It takes strong leadership for a community to flourish. The Kansas Health Foundation has fostered leadership training for over a decade. From the creation of one of its key leadership programs, the Kansas Community Leadership Initiative, a program that helped transform over 40 community leadership programs throughout the state, to the launch of the Kansas Leadership Center in 2007. The Kansas Leadership Center is a statewide leadership development organization with the charge of cultivating civic leadership throughout Kansas.
The Kansas Health Foundation, trying to connect the health of the community to leadership in the community and the qualities that make good leaders, actually connected a different dot and said if we can improve the skills and capacities of people in the community, then everything's going to be better, including the health. The Kansas Health Foundation actually committed funds to create the Kansas Leadership Center, so they still play a key role in leadership training while they focus on the broader community. The Kansas Leadership Center has a program called the Art and Practice of Community Leadership. They have a faith initiative that they're working on. They work with government and governing bodies and the people who serve on them to talk to them about different ways to approach community issues and community members.
And so the effort to improve the health of all Kansans has broadened to include partners in all parts of the state, and that effort continues.
There is so much work that needs to be done here. We think we have the right model, and with the Foundation's help, we think we can make a long-term, really meaningful change.
I'm excited about being a partner with the Kansas Health Foundation, and I really look forward to that partnership in the future.
By the work that Kansas Health Foundation supports, we can kind of try to lend more to prevention rather than reaction.
The possibilities of what different communities, including ours, can do with the Kansas Health Foundation are endless.
Without the foundation, public health in the state would not be in as good a position as it is.
Health isn't the end, people are the end. We improve health so that people's lives are better, and we believe that, and the Kansas Health Foundation does too.